Hello friends, welcome to OET Wings. So today I'm going to discuss with you about some last minute preparation and things to do in the OET exam. Friends, if you are not subscribed to this channel, please subscribe and share it with your friends. Okay, let's begin. We all know that the writing subtest is easy compared to IELTS exam, but it is not that easy like you think. Do not take it lightly. You need to practice and work hard. However, some tips can be used and that will be helpful to make your writing subtest easier. When you get the question, you have to first read the task. Yes, read the task first and understand to whom you are writing and why you are writing. Then read the discharge plan or last given nursing management, because that is going to give you complete information such as what you are going to do with this letter or what you are going to write in this letter. Then you have to skim and scan for the diagnosis. After that, do a small recap. So now you know that what is the task, what you need to write and what the question is asking for. I can assure you that this is enough to write the introduction, and of course you need the patient name and age. Then read each and everything from top to bottom. You should not leave anything which is given, because everything is important, and while reading just find out the points that need to be added and all the points need to be eliminated. According to the question type, we can eliminate, because if you are going to write for wound care assistance for a patient at home, why you want to write some other topics rather than the patient condition? For example, patient had a fall 5 years ago. Let me give you another example. Patient's wife is working as sales manager, or his parents died due to cancer. These are irrelevant and this should be eliminated. Yes, an important thing I forgot to tell you, that the 5 minutes which is given to read the question should be used properly. As I said, read the task, go for the discharge plan, find out diagnosis, then read top to bottom. So this 5 minutes can be used effectively. And in this time, you are not allowed to use a pencil or a pen, but take time and then give numbering to the points, like what are you going to write in the introduction, or you are going to write in the recommendation or in the paragraph wise. So give number 1, 2, 3. 1 represents right, like introduction, like 1A, 1B, 1C, 1D. Then the second paragraph is for number 2, 2A, 2B, 2C. So in that way you can write the points, so you will not miss any points in that way. Also in the closing sentence you have to by heart it, friends, like the please contact us for any further information. I will give you a description, will give you a link in the description so that you can see the video and you will get more information. Also you can check other videos to get more idea about the OET exam and tips, and also about some model questions and answers are there in the other videos. So you go and check. Or in case if you have any doubt, you can always ask us. We are here to help you, so don't worry about that. And one more thing I want to tell you, that it is an important point. Do not forget to put full stop, because most of the candidates are forgetting to put full stop at the end of the paragraph. Another thing, if you are using as, since, although, even though, in order to, etc. things. Don't forget to put comma after the first clause. Also, if you use in addition, moreover, however, like that connectives, do not forget to put a comma after that. Then write as simple as you can. It should be simple, legible and clear. The main thing is that the idea should be communicated. And before writing or before starting to write the letter, plan yourself plan yourself about what you are going to write and how you are going to write it. Okay, so take time. If you are taking 10 minutes, 15 minutes, that is okay, because if you are already having a plan, you are not going to take more than 15 to 20 minutes for writing the letter. So you don't have to worry about that. Take time to plan. Your planning is important. And then write, and at least take 3 to 5 minutes to read the letter, so that you can avoid simple mistakes like spelling mistake and what I said like comma, full stop. This can be avoided. So you have to plan, write, then proofread yourself and avoid the mistakes. Another thing is that if you are going to mention the disease condition in the introduction, then you don't have to repeat it again. That means the information which are already written should not be repeated until and unless it is unavoidable or that much important. And I'm sure that you are aware about the structure of the letter. It is like introduction, second paragraph. In the second paragraph can be social, medical and family history. Then the present condition or complaints of the patient. Then next paragraph is the recommendation, last closing sentence. You can also write social, family and medical history as the second last paragraph. And this thing all will be like depends upon the question type and question model. And this also I am going to give you in the description. Go and check. I will be giving the link, so you can get more information from there. And another thing, if the patient is about to shift to an emergency department or the situation is emergency, then you don't want to write some history like patient is skillful or patient is a music lover or she usually plays hockey, she loves gardening. These are unnecessary. You should avoid that. So just use your common sense. So this is an emergency situation and you are transferring the patient to another department or another hospital. So think yourself whether there is any need that this information could help them to treat the patient. Patient is a music lover or she plays football. Is that information is going to help the doctor or the caregiver? That is what you have to think about. And also, regrettably, fortunately or unfortunately, this kind of things, it can be avoided. What I feel is write it directly, like she has been suffering from diabetes mellitus since 2000. That is good. Write it directly. Do not write regrettably. She has been suffering from diabetes mellitus since 2000. That is, it's awkward. About the connectives, don't write more than 4. The maximum number of connectives you have to use is 4. Please don't write more than that. And one more thing, please write small letter after a comma, because many of the candidates are writing capital letter after the comma. It is a major mistake. So after you put a comma, start small letter. not with the capital letter. So friends, if you have any doubts so far, please comment under this video. I will definitely reply you. So don't keep your doubts in your mind and go for the exam. Reading tips have already been given to you, so I will give you the link in the description. Please go to that video and check it. If you are not yet subscribed to this channel, please subscribe to get the new uploads first. Best of luck with your exam. Hope you will all do great. If you have any doubt, as I said, just comment under this video, or you can also contact us oetwings@gmail.com or oetwings in the Facebook page. So that's all for today. Thank you guys. Have a good day.